Hi, my name is Jordan and I'm a nursing student at the Community Living Center unit at the VA hospital. I'll be presenting a patient today. The patient is a 24-year-old single Caucasian male. His former occupation was the Air Force. The patient's chief complaint was that his multiple sclerosis was interfering with his activities of daily living. He was admitted in January of 2014 for a flare-up of MS. Patient was diagnosed with relapsing remitting MS at the age of 22. Due to memory loss caused by his MS, he was unable to provide a full account of his medical history. His vitals are stable, and his heart rate is 73, respirations 14, blood pressure 124/78. Past medical history. Patient denies any serious illnesses. All immunizations are up to date. He is allergic to compazine. His past surgical history, he had LASIK eye surgery, and patient's current medications are baclofen to treat muscle spasms, Docusate to soften stool, heparin to inhibit blood coagulation, and ranitidine to prevent heartburn caused by acid indigestion. Functional assessment. Patient denies alcohol, tobacco, and drug use. Patient does not have a regular exercise routine due to the fatigue and limited mobility caused by MS. Patient states difficulty sleeping when on certain medications and denies any sleeping disorders. Patient denies eating difficulties and drinks 2 8-ounce cans of pop per day. Patient requires a wheelchair for mobility. Psychosocial. Patient states he has a good relationship with his family. He denies feeling stressed. Patient is not spiritual, and he states his highest level of education is college. Family history. Patient denies any pertinent family health history. System 1. Neurological. Due to the patient's diagnosis of multiple sclerosis, it is important to assess his neurological function. Patient states he has had several concussions. He denies any numbness, tingling, or seizures. Patient states he was exposed to hazardous chemicals during his time in the Air Force. He reports he has difficulty in concentrating, memory loss, fatigue, inadequate coordination and balance, and sometimes has difficulty with speech. Upon examination, the patient appears in no acute distress. He is well nourished and has a healthy BMI. He appears stated age. He is alert and oriented to person, place, and time. Patient demonstrates slowed movement in speech and avoids eye contact. Optic nerve was intact. Pupils are equal and round, but are not responsive to light. Ocular motor function is intact in all directions, indicating intact trochlear and abducens nerves and the intact motor function of the ocular motor nerve. Trigeminal nerve is intact, indicated by strong masseter strength and ability to sense touch. Facial nerve is intact, demonstrated by normal facial expressions. Vestibulocochlear is intact, indicated by patient's ability to hear whisper in both ears. The patient's uvula rising centrally demonstrates an intact glossopharyngeal nerve. Patient demonstrates hoarseness, which indicates a possible dysfunction of the vagus nerve. Accessory nerve is intact, demonstrated by strong shoulder shrug and head movement. Hypoglossal nerve is intact, indicated by protrusion of tongue and ability to say light, tight dynamite. Unable to assess gait or Romberg test due to patient requiring a wheelchair. No Babinski reflex or ankle clonus noted. System 2. Musculoskeletal. Given the patient's diagnosis of multiple sclerosis, it is necessary to assess musculoskeletal function. Patient reports constant pain and swelling of the joints. His pain is a 3 out of 10. Patient states he has a muscle weakness and that his movement has become somewhat limited in the past year. Upon inspection, the patient's bone structure appears symmetrical with no deformities. Muscle mass appears symmetrical with no atrophy. Range of motion is somewhat decreased in both upper and lower extremities, and movement is slow. Patient demonstrates 5 out of 5 muscle strength in all extremities, except his finger grasp is rated a 4 out of 5. No edema present. Pertinent System 1, integumentary. According to an article by Multiple Sclerosis Trust, patients diagnosed with MS are at a higher risk for skin breakdown due to changes in sensation, spasticity, reduced mobility, and cognitive function, so it is important to assess the patient for pressure ulcers and other skin lesions. Pertinent System 2, peripheral vascular. According to an article published by Neurological Research, patients with MS have an increased risk of vascular disease and venous thromboembolism, so it is important to assess the patient's peripheral vascular system for signs of thrombosis and arterial and venous insufficiency due to his decreased mobility.